Venetoclax is a novel BCL2 inhibitor which has been licensed and approved in CLL and has been very effective in that disorder. Clearly there's been interest in other disorders, and mantle cell lymphoma is certainly one. There's some suggestion of synergy with BTK inhibitors. BTK inhibitors, particularly ibrutinib, have been available around Europe following the licensing trials and America. And it's been clear over recent times that the effectiveness of ibrutinib particularly is improved in the first relapse setting in mantle cell lymphoma, leading to a situation whereby many patients will start to relapse following ibrutinib, and this remains an area of unmet need. Certainly in people with relapsed refractory mantle cell lymphoma, their survival is approximately 2 years. And so this remains an area of real interest and development, and venetoclax has been studied in this area in the UK following a compassionate use scheme. 20 patients were involved in this study, and this was a high-risk group of patients with a median progression-free survival following ibrutinib of only 4.8 months. The overall response rate to venetoclax in this setting was 60%, but this was limited, and patients progressed early with a median progression-free survival of 3.2 months and an overall survival of just over 9 months. Within this group of patients, there were a number of patients with blastoid disease, and their responses were very limited, and a number didn't respond at all. So within any compassionate use scheme, it's likely to represent a high-risk cohort of patients, and so this was certainly the case here. But the encouraging response rates of 60% compare really quite favourably to immunochemotherapy in this setting, and there are some retrospective series using immunochemotherapy and also lenalidomide. Bendamustine rituximab is probably the best studied, and the response rates are approximately 30 to 40% with an overall survival of between 4 and 8 months. So there's no clear and obvious difference here in terms of response rate comparing immunochemotherapy with venetoclax, but venetoclax is a very non-toxic agent, and certainly in the relapsed refractory setting that's important for patients and physicians. And what this study does do is it provides further evidence for the potential role of combination therapy, including venetoclax in this setting.